No running, swimming, or lifting heavy weights. The Health Ministry is advising people to avoid such strenuous activities for a week after receiving each dose of the COVID-19 vaccine, especially for adolescents and men below 30 years old. This latest advisory comes after a 16-year-old suffered a cardiac arrest shortly after he lifted heavy weights at the gym. This happened 6 days after receiving his first dose of the mRNA jab. Gyms and sports clubs here are stepping up precautions in light of this. Shalin Xia with more.
This gym has sent out email and phone notifications to members, reminding them to avoid working out for 7 days after getting their first and second vaccine doses. Coaches will also remind them in person.
This posture, it comes from an abundance of caution. Those under 30 probably do need to be a little bit more careful because those are typically the most kind of rah-rah, young and go for it in the gym and competitive CrossFit sessions and things of that nature.
Another gym says it will put up notices to remind people about the new advisory. Personal trainers will not schedule training for those recently vaccinated. And even if they do train, it will only be light workouts.
It has to be individual responsibility. You should know as an individual when your vaccinations are. But we will do what we can to try to make sure that the members are safe and they are well.
The Swimming Association says it has asked all athletes to let the managers know when they are getting vaccinated. Athletes are also told to take a week off training after the jabs. Doctors are urging people to follow the advisories, while emphasizing that vaccination benefits still outweigh the risks.
Vaccination is a form of stress on the body, and if an individual has a prior heart disease, it is potentially possible that something may have provoked the cardiac arrest. However, these are very rare, and I would say that myocarditis, from what we have from our data in Singapore and globally, the numbers remain low.
COVID can actually cause myocarditis in a much higher proportion than the vaccine possibly, having an effect on the heart muscle. So having the vaccine potentially protects somebody from all these very bad outcomes.
They added that if people experience any chest pain, shortness of breath, or abnormal heartbeats within the week after vaccination, they're urged to seek immediate medical attention.
The Education Ministry says students are excused from physical activity for a week after receiving either the first or second vaccine dose. Teachers also check in with students before these activities start. As for the 16-year-old who suffered a cardiac arrest, the Education Ministry says his school is monitoring his condition closely. It's also in touch with his family and classmates to provide support and assistance.